Absolutely. This study is intended as a safety study. It is open label, and the purpose of that is really to make sure that we are inclusive of even younger patients who suffer with atopic dermatitis, recognizing that atopic dermatitis often manifests by the time the child is 1 year of age. We really felt it was critical to include this younger cohort of patients in a special study to understand better their response to roflumilast. This particular concentration is a bit lower. It's 0.05. We know that the skin in an atopic patient is often compromised. The barrier is not as intact as a normal patient's skin would be. And even when the skin looks normal, it really isn't completely normal. So therefore, we undertook this study. It was a 4-week study. The patients did receive the medicine application once daily. There were certain criteria for the patients to be enrolled. They had to have mild to moderate atopic dermatitis, and they were required to have at least 3% body surface area. Patients were not enrolled if they had active infection or if they had another chronic condition which might have prohibited us from adequately assessing the status of their atopic dermatitis during the course of the study. The patients were enrolled, the medication was provided. We, of course, were responsible to record not only their progress in terms of atopic dermatitis, but also if they had any adverse events. So a very typical clinical trial in the realm of topical medications for dermatology patients. The study was very successful. We felt that we got the data we were looking for, and we really hope as we go forward and the data goes under final analysis, we'll be able to bring it forward to the FDA and ultimately get a younger pediatric approval than we currently have, as we do have approval down to age 6 for the 0.15% concentration of Zoryve. One of the things that was determined in this clinical trial was that the outcome was favorable. And that was, of course, what we anticipated, given that we had such good data on older patients in 4-week studies. The delta in terms of placebo versus active drug in our older patients was significant, and it was early in onset. So again, we felt very confident using this lower concentration in our younger cohorts with the expected outcome that we would see positive results. And that is indeed what we were able to achieve during this particular clinical trial. Well, first and foremost, we had no serious adverse events. That's always an important criteria in a clinical trial. It's particularly important as we deal with very young children, where we know they're considered a vulnerable population because they can't often articulate what might be going on. So their parents or guardians have to speak up for them. We had very few infections during the course of the study. We did see the skin barrier improve. We saw itching reduce. We saw that the patient's assessments during the clinical trial also were of value because they clearly got better. I have to say, I saw one of my youngest patients back in clinic just today, and I've been very pleased to see the ongoing improvement that's been maintained in that particular individual patient. I know that's an N of 1, but it's always reassuring to see that you can use the medicine on an ongoing basis for a chronic disease and get sustained, safe results. So again, good safety, good efficacy. These are cornerstones of success in a particular clinical trial for atopic dermatitis, which is, of course, a chronic relapsing condition.